Hi, I'm Bernard Nomberg with the Nomberg Law Firm in Birmingham, Alabama. And we keep up with the news like everyone else does, and the fears, concerns, and information that's spreading about the coronavirus is all over the board. So what we've done is try to consolidate, and the purpose of this video is to pass along the information that we've learned from the Centers for Disease Control and Prevention and the World Health Organization as some helpful tips, some things to think about, so that fear is tempered with some reason, some panic it is replaced with patience, and uncertainty is goes away, hopefully, with a little bit of education. There's so much information out there, and we're certainly not scientists, we're not doctors, we're not medical providers, but we want to help to educate, we want to help provide information that we think is sound, is reasonable, and for you to hopefully to consider. From what we have read and from what we have seen in the news and from these trusted sources is that most people who come in contact with coronavirus, COVID-19, is going to be pretty mild illness with pretty decent recovery, meaning it can be more severe for others depending on age, depending on immunity, depending on a lot of other factors. But most people who get it think more like the cold or flu-like symptoms. And so there are several things that the World Health Organization and the CDC are suggesting that you consider doing to help minimize the spread of the disease, to help reduce the likelihood of you and or family members are affected by the condition. One of the things is called social distancing. That may be a new term for most people, but what it really means, what they're trying to say, is to avoid crowds. In addition to that, instead of hugging or handshakes or whatever your normal greetings are, consider fist bumps, elbow bumps, foot bumps, or in the yoga world, just a namaste. It's the idea of just not having human-to-human contact with people would help. Avoid touching your eyes, your nose, and your mouth, because throughout the day, there's no telling how many surfaces you touch. Door handles, surfaces in a kitchen, at restaurants, wherever you may be, and avoiding touching really helps. Practice respiratory hygiene. If you have to cough into your elbow, into the crook of your elbow, and then still go wash your hands. And if it's into a tissue, dispose of that tissue immediately. Washing your hands frequently throughout the day helps considerably. Hot water and soap will help. If you have a cough, a fever, difficulty breathing, you should seek medical attention early, but don't automatically go to the emergency room or to urgent care. Consider calling your primary care physician and talking to the nurse or the doctor, and then follow their advice. If you're beyond this average coughing, fever, and those types of things, then use your normal common sense and what you think you should do by going to an emergency room. Stay informed of what your local healthcare providers and government leaders are telling you about what's going on in your community about the spread of the condition. Concerts, conventions, seminars, other large gatherings are being canceled all the time. Now, we're not informed enough to know if this is an hysteria or an overreaction, or if it's just keeping common protocol or common sense, if you will, so that the less people are together in large gatherings may help with the lessening of the spreading of the disease. Now, many people want to know, should I stock up on foods? Should I stock up on my medicines? Again, not to spread into any fears or spreading that misinformation, but having non-perishables, just like if it were a bad storm, if you were housebound from bad weather, tornadoes, ice, snow, whatever it may be, keep non-perishables in your house. Keep things such as chicken broth, crackers, and all of those types of things. Have Gatorades, Pedialytes if you have children. Those types of things are always good to have in stock in the house. Also have, I guess you call them sick foods or sick bed foods. If you have soups, if you have, let's see, crackers, bread, those types of things that you would eat if you didn't feel very well. Keep all of that in stock. If your insurance company will pay for it, keep extra amounts of your medicine in stock in your home. Again, it's a person by person basis, but it's just some things to be thinking of. Your daily medicines are very important to you, so make sure that you don't run out of those. If you've been recently visited a country, a place, or a person with people who have where the virus, the COVID-19 virus, is spreading, what they're suggesting is should be a quarantine, and this is for people who've been exposed within the last 14 days. There should be a quarantine that should be followed, but again, you should follow what your local community leaders are suggesting, and you should consider going to, and I'll put this below the video, the websites for the CDC as well as the World Health Organization. Talk to your employer about whether you should work from home. Is telecommuting an option? It is at our office, that we have various times throughout the year for different reasons. Office members can work from home, and they do so quite easily. Let's see if there's anything else of real significance. In your home, consider wiping down the surfaces that get touched quite a bit. Door handles, again, maybe keeping a lot of those supplies handy. The kitchen counters, chairs, whatever surfaces where people visit quite often should be considered cleaned. And that goes for your office as well. Now, whether you should wear a face mask or not is of highly debate right now. I know that there has been quite a run of those masks, but the science, from what we've read, it's really mixed, whether or not they actually help. Maybe wearing a mask around people who might be infected might help you somewhat, but it really is of no real measure of a benefit of wearing the masks. If you have elderly relatives, do you have a plan in place? If you have children who attend a daycare or school, are there plans in place? These are just things to think about. The last thing I'll say, and this is, I've seen this several times, that when you're washing your hands, which you should do frequently, what song do you sing? The length that's suggested is maybe the happy birthday song twice. But certainly there are all kind of lyrics you can find out there that go half a minute or so. Anyway, educate yourself. Don't panic. Become knowledgeable. Do those things that will help you and your family. And we hope that this video in some small way will help you. And if you have questions or concerns about this, just please give us a call. 205-930-6900 is our office number in Birmingham, Alabama. Hope you guys do well. Take care.